generous support from the German Development Agency GIZ, Safaid is implementing the Health Safety Project, an initiative designed to empower young women and girls. Health Safety, an acronym for secured, assertive, focused, empowered and transformed young women and girls, aims to create a safe, supportive and enabling environment for young people in Lusaka and Southern Provinces. In Southern Province, the tourist city of Livingstone is among the 3 districts where young women, girls and boys are benefiting from this transformative initiative. The project seeks to address the root causes of HIV infections, early and unintended pregnancies, as well as gender-based violence in communities. A key feature of the program is the introduction of quarterly interface meetings between service providers and young people. These meetings provide a structured platform to identify challenges, review service delivery gaps, and find solutions using feedback collected through the Mobi Safaid's application. Safaid country representative Crispin Chomba led a joint team of Safaid and GIZ staff in conducting interactive sessions at Livoyu Clinic and Livoyu Secondary School, respectively.
We're here in Livingstone to undertake a very important exercise, which is part of our program being supported by GIZ. Our program is called Health Safety. It's a program that is aiming at improving the health outcomes of adolescent girls and young women, but we do not leave the boys out of the equation. This program is addressing early and unintended pregnancies, child marriages, HIV, SGBV, and of course, low uptake of SRH services. SRH services being sexual and reproductive health services. Southern Province, as well as Livingstone, is one of those places worst affected by HIV, GBV.
Here, young people had the opportunity to openly engage with service providers on issues affecting their access to sexual reproductive health services.
Their services resolved, or their issues will be resolved when the issue reaches to the in-charge. Yes, the in-charge, when she receives the issue, she will make sure the issue is resolved.
When you go to access or have condoms, you find that one person will be demanding all the boxes. So I think there it would be better if the healthy service providers put a number to say maybe one person can be getting such package, because there are a number of people who needs the services also. So on that part, I think it would be better if they come up with an idea of finding, so each and everyone who comes at the time, they'll be finding them available.
At Livoyu Clinic, nurse in charge Nolia Nanjame shared insights on how the project is strengthening service delivery and improving responsiveness to the needs of young people.
We are one of the facilities that are receiving support from GIZ through Safaids. So actually they are supporting us in adolescent and young people activities through the scorecard and also the mobile app, where these adolescents actually they're giving feedback to us as a facility on how we are rendering the services and to them. So we have actually benefited through this project or this activity, in that we as a facility we are actually receiving feedback on how our services are being rendered to the adolescents and the young people there. And with that, it has actually helped us to improve in service delivery to the young people, where when, for example, they come to the facility, maybe they wait for long hours and they are able to raise the tickets through the in-charge. So meaning me as the supervisor, I'm actually aware of what is happening in all the departments, because that information is able to reach me. Then quick action is done immediately so that these adolescents are able to receive the services.
Young people themselves say the initiative is already making a difference. They highlighted improvements in communication with service providers and increased awareness of their sexual reproductive health rights.
In the activities which involves youth, they have set a platform which allows youth participation, whereby they can be able to say or to speak out the challenges they face, which cannot be told directly to a person, but using the application, it can be easy, because no one can be able to recognize to say the one who sent the information is this. And this has brought active participation to youths, whereby they are able to raise their barriers, to raise complaints they face, for them to have a well-service attention.
Government has also taken note of the project. A representative from the District Education Board Secretary's office, Hampande Ritual, participated in one of the interface meetings held at Libuyu Secondary School.
The support from Safaid means a lot to us, in that we have a lot of learners, more especially girls, that fall out of school because of teen pregnancies. Myself, being the guidance and counseling teacher, when I receive this data, sometimes it's really scaring that you can have such data of a lot of learners who fall pregnant. So when organizations like Safaid come to be in our midst, it's really a shot in the arm, because they bring a relief to us, in that they are doing some part of the work that we are supposed to do, but because we cannot do it, all of us. So having organizations like Safaid really helps us to alleviate the challenges that our young girls go through.
The interface meeting has since generated commitments from policymakers, decision makers, and other key stakeholders to address sexual reproductive health service barriers at Libuyu Health Clinic. It is hoped that through continued collaboration and targeted interventions such as the Health Safety Project, challenges affecting young people's reproductive health services will be effectively addressed.